Lead Connect and Care Festival. Hi, Rebecca. Nice to see you. We've actually got a session now with Sarah Amos. So it's fantastic to welcome Sarah Amos from NHS England and Improvement. And Sarah is actually going to be spending some time with us, talking to us about the National Health and Wellbeing Offers. It's really important that you have an understanding of what's available, and all of us access this because it's for our benefit. So more on that shortly. Some of you will be aware we launched this Lead Connect and Care Festival on World Kindness Day, which was Saturday. It was Saturday the 13th of November. And one of the things that we want is the kindness vibes to continue throughout our festival week and beyond. And we actually shared a video on Saturday. It's 10 minutes long. Now, we haven't got time to play the whole video, but we wanted to start the session with a snippet. In the chat, we'll put the link so you can listen to the full animation. But Jem, do you want to play a snippet?
Kindness is about being friendly, being supportive, and ensuring that others feel included. It's about looking after people in the way in which we want to be looked after ourselves. And I think really importantly, it's about behaving in private the same as we behave in public. It's clear that lots of people are struggling at the moment. Life was difficult before COVID, and COVID has made our working lives and our personal lives even more challenging. I think the moral case around being kind is obvious, but beyond that, when you look after people, it's easier for them to do a good job. So the quality of care that patients receive improves. And when people are happy at work, and I think kindness can support happiness at work, it positively impacts on our personal lives. So I live in a village in South Leicestershire, and a couple of months into COVID, we set up a village WhatsApp group. And the key aim of that was trying to look after the people in our village. There's lots of retired people there. There's people who live on their own. So using the WhatsApp group, people were able to purchase food for people, to collect medication, to look after the vulnerable, to check in with people. And I sense that we communicated, and we are communicating in a way that had been absent for the last 8 years in the village. And as we've had some form of normality return to our personal and working lives, although it continues to be far from normal, that sense of village life and us as a collective working together has continued. And I hope it continues for much longer too.
Fantastic. So that's just a snippet of the animation. It's 10 minutes long. We'll put the full animation in the chat. No, he doesn't live in a tent. Sophie, that's hilarious. Brilliant. And just a real key message there about kindness and the impact this has on happiness and the difference it can make to our people and our lives, our personal lives. So more on how you can get involved during the festival week at the end of the session, but it gives me great pleasure now to hand over to Sarah. Sarah, over to you.
Thank you. So as Brina said, I'm Sarah Amos. I'm the Health and Wellbeing Manager for the Midlands region. So that means I work with trusts and ICSCs to ensure that they know how to support their staff, they know what's nationally available, and we link in with what they do locally. And I think, that one of the things I can say is that LLR is one of the most advanced systems in terms of its health and wellbeing. There's been collaborative working all the way through the pandemic. So, I think you are really lucky to work for such a forward-thinking organisation. Health and wellbeing was thought about before the pandemic, and sadly, in some organisations, it wasn't. But I just wanted to touch on the kindness theme because I remembered it was Kindness Day on Saturday because I'd met with Bean and she said that's when we're going to launch the festival, and I thought that was amazing. And I thought a lot about kindness, and as usual at the weekend, as a working mum, I'm hoovering, ironing, washing, cleaning, running down to Aldi to do my shop. And I'm just putting my trolley back in Aldi, and there's a lady looking absolutely harassed with a child, and she's obviously forgotten her pound coin for the trolley. So I unloaded my shopping, I put my trolley back. I've got a token in the car that I always use. So I went up to her and I said, have you forgotten your pound coin? And she said, yes. I said, have my token. And she went, are you sure? And I said, yeah, you'll have to go home. And I've been there in that car park with no pound coin. And she was genuinely shocked that someone had done that for her. And I didn't think that was a massive thing at all. It was a token from the pound shop. She was really chuffed because it was pretty. And I just thought if more of us did things like that. But also it just made me sad that people were shocked that people do things like that, because I think some of us have forgotten how to be kind. And I think when you're working in the profession that we are within health and social care, it's within us, isn't it, to be kind? Because, you know, let's face it, not many of us do these jobs for the money, do we? We do it because we want to make people's lives better. And I think kindness running through everything that we do is a brilliant way of working, and being kind to each other, but most importantly, being kind to ourselves. And this presentation is just a reminder for you to be kind to yourselves. You are working really hard in really difficult circumstances. Some of you are supporting teams as well. And we've heard all these things, you can't pour from an empty cup and all those things. And this is just a reminder that there's lots of support available for you. And lots of it is available whenever you need that support. So don't think that it's, oh, well, if I don't make an appointment at 10, I can't join in. So I'm going to take you through what we're offering. Please put your hand up, shout, put stuff in the chat box, whatever works for you. Ask as many questions as you want. I'm now going to share my screen, which I'm not going to fib, always gives me a bit of anxiety because it never seems to work smoothly. So just bear with me 1 second. Right, I'm hoping that now you can see that. And I'm hoping it's going to go onto slideshow. There we go. So we're going to talk about staff experience, health and wellbeing, the people promise, health and wellbeing conversations, the staff survey, and what we've got on offer. I can't see anybody now, but the chat is on my phone. So if anyone wants me or wants me to stop or anything, just put a message in the chat box. So you know that we've got the people plan now, and the people plan is our long-term commitment to health and wellbeing of staff. We've seen all the research, we've done all the reading. If we look after our people, if we make them feel safe, physically and mentally healthy and well, they will deliver brilliant care. And it's not just about delivering brilliant care, it's about looking after ourselves and really making people feel valued. You know, we want that sense of belonging in the NHS. We're looking at new ways of working, flexible working, different, you know, I had a presentation yesterday about the money that we'd save doing video consultations for secondary care. And, you know, there's lots and lots of different ways of working, and we're really looking at how we can expand the workforce, because we know the biggest problem that we've got at the moment is probably recruiting and retaining our staff, for lots of different reasons. So these are the pillars of the people plan, and this is why the people plan is there. And it means that your organisations within the NHS have signed up to this. So they've made a commitment to you as your staff, as their staff, to deliver on these pillars. And I just put that in. I thought it was a really nice graphic about what it stands for. We're a team. We each have a voice that counts. This is the people promise, isn't it? We're compassionate and inclusive. We're always learning, safe and healthy, rewarded and recognised. So I'm going to send this presentation out, and it'll be on the website. So I'm not going to read every little thing, but they're the different elements of the people promise, and the graphic along the bottom demonstrates that. There's 1.3 million people within the NHS. It is the biggest employer in England, so we really need to look after our people. So the first thing I'm going to mention is the health and wellbeing conversation. So all of you will be entitled to have a health and wellbeing conversation, and that can be with your line manager. If you don't feel comfortable to have it with the line manager, if you reach out to a member of HR support, they'll be able to put you in touch with somebody to have this health and wellbeing conversation. And it's looking at your health and wellbeing. It's not a counselling service, it's a signposting thing. So if you are struggling and you have this health and wellbeing conversation, your manager will be able to signpost you to different areas of support, because there's lots and lots of support available. I think sometimes people feel a bit overwhelmed and they don't realise what support is available. So this conversation would be really helpful if you're one of those people, because it will help you signpost be signposted to support. If you're a manager, that will be part of the role for you to signpost. But we don't want managers to be alarmed by this. You know, like I say, it's not a counselling session. It's not, oh, come and tell me all your worries and you'll go home feeling brilliant and I'll be all worried about everything. This is about a adult conversation, one-to-one, just to really look after people and make sure they understand that they can bring those things. If they can't speak to a manager, there's someone else they can speak to about those issues they might be having. So they're caring, compassionate, employee-led, supportive, and there should be an ongoing thing. We don't want it to be, oh, once a year I've had my health and wellbeing conversation, so I can't talk about my health and wellbeing ever again. They're going to be inclusive. We developed some work for line managers about having conversations with people who might not look like themselves, to make sure they can think about all the protected characteristics and have that really sensitive conversation. It's not judgmental. It's not a formal risk assessment. It's not therapeutic interventions. It could signpost. Next, the staff survey. There's some really important questions within the staff survey that ask about your health and wellbeing. And I can't stress enough how important it is to complete the staff survey. It's our opportunity to have our say. And by doing this, we can then understand what we need to do to provide next year's health and wellbeing offers. Is it stuff that we need to do more on MSK? Do we need to do more mental health support? You know, this really does help us. Do we need to do stuff on work-life balance? So please, if you haven't already done so, complete that staff survey. It is completely anonymous and it gives not only NHS England an improvement, but your organisations a really good picture of what's going on. I can talk to you all day about health and wellbeing, and I can tell you about a million offers, but it's all about self-compassion. And unless you give yourself the time to either engage with these offers or find something else that works for you, I'm wasting my time, really. My message is you have to prioritise you, and we all have to do this. And sometimes it feels a bit selfish, and sometimes it feels a bit mean, because you think, well, actually, I've got kids to feed, pets to walk, all these different stresses on our time, but we need to put ourselves first. And so it's about self-compassion, isn't it? So we thought these graphics really were very visual reminders, you know, connecting with our friends and family, trying to be active. I've worked with one of the trusts and they're advocating walking meetings, even if it's only a 10-minute catch up, just walk around the hospital grounds. Some of the places have got really nice outside space, some not so nice, but it's just getting out and having a bit of fresh air and just to walk around the block. Taking notice of things that are going around us and having that minute to reflect. It has been a really hard time and we're allowed to reflect and think that. Keep learning, you know, there's things we can do. Lots of us have learnt new skills in lockdown, haven't we? Some people have been knitting, crocheting. Look at Tom Daly and his knitting. So, you know, take time to think about what you'd like to do and do something for you. And, you know, this give a smile. This is our kindness message, isn't it? And that's what's coming through this whole festival, is this kindness. Talk to people before you finish. If you've had a bad day or you need to get something off your chest, remember to switch off, and don't think that self-compassion and self-care has to be all sorts of, you know, wild and wonderful things, sitting in a room meditating. If yours is just to sit and watch EastEnders with a cup of tea, then you make time to do that. And we must always try and eat well, sleep well, exercise, because we know that makes us healthy, keeps us healthy. So you've seen lots of these graphics. There were lots of them were started at the beginning of the pandemic. So this is the support that's available to you and your colleagues. So I'm going to go through the support, but we've had, you know, nearly 1 million people have been on the website. With nearly 250,000 people have downloaded apps. We've had nearly 14,000 coaching sessions. Wellbeing webinars with over 130,000. So these are, you know, we've tried and tested these, and we've really tried to make sure they're inclusive and fit the bill for yourselves. So this explains that, you know, we're doing this because of the people plan, and the people plan ensures that your health and wellbeing is at the forefront. Every organisation within the NHS has a health and wellbeing guardian, and what their role is to hold the board to account. So when they're talking about cancelled operations and finance and get gaps for this, that and the other, and we need to get people in, out the other, they will be saying, but hang on, we need to make sure our staff are safe and well to do this, and they will keep putting that at the forefront of the board's mind. So they are acting on your behalf to ensure that your health and well-being is not seen as is always seen as a priority. So this staff support line has been running throughout the pandemic. It's run on behalf, the Samaritans operate this for us, and there's that's 7 days a week, 7 till 11, but also there's a text line as well. These have been really, really popular. People are just using them. Sometimes they just need a sounding board. They just need to have a little rant about what they've seen. Some people have real major issues, and then we can signpost them to different things. So if these lines are here for you and will continue to be here for you. So please, if you've got one number in your phone, get that phone number and the text number just in case. And I would encourage your staff to do the same, because in that moment when you need help, there is help available for you 24 hours a day. And I know some of the organisations have got additional listening services, but this is the one that we're running. Again, it's Samaritans, it's completely confidential, so you can use that whenever you need. We've got a bereavement support line. This isn't just if you've had a bereavement in your family. You might be struggling with the bereavement that you're seeing through your jobs. We've heard about the demographic changing for COVID patients and how that's a real additional stress for frontline workers. So, that is there for you, not just for family bereavement, but a support line there. We've got counselling support from the Association of Christian Counsellors. All of these are available. There's a link on the bottom of there that we'll send out. So you've got the link. You just click on the link and you can choose what it is that you'd like to look into. We've got Looking After Me Too, which is coaching support for our Black, Asian and minority ethnic colleagues. This I'm going to send a reminder out to this for all organisations tomorrow. You can get seen as early as next week. We've got appointments for next week. So if you've got colleagues or you yourself are from one of these backgrounds and you want some tailored coaching support, then it's available to you free of charge. It's online and there's loads of different slots. So that's a real valuable resource. So please, try and promote this to people who might be struggling and who you think coaching support will benefit. We've got an Islamic mental health and wellbeing service as well, which is mental health counselling, but it is faith-based. And then Project 5 is accredited clinical psychologists and mental health experts. So these are all available. You can just click through and see which you think is the best one for you. There's some resources on here about having what health and wellbeing conversations. So you can think about what if you're conducting it, how you might conduct it, but more importantly, if you're the person having the health and wellbeing conversation, what can you expect? What's okay for you to discuss in this meeting, and just see what it's all about. So that's on the website too. I don't know whether we've got primary care colleagues on the call, but there is primary care coaching offer that's running. It's called Looking After Me Too, accessible through the website. We acknowledge that primary care are also having a really, really difficult time. And I think we've had lots of stories from receptionists and medical secretaries who are really struggling, as people are not being kind at all, are they, to them? So this coaching support is available through this link. We've got wellbeing apps. If you've never tried Headspace mindfulness and you'd like to, download the Headspace app. It's free for NHS people, and it's free until next December. And I'm not sure how much it is a year for that, but it's not cheap. So that is a real added value thing for you to have. If you download it and you don't get on with it and it's not for you, you've wasted nothing. But just give it a try. There's other apps there, but the Headspace has proved really popular throughout the pandemic, and like I say, they're continuing to support the NHS until next December. So that's a really good time for you to get really attuned to mindfulness and see how it could work for you. And then there's Unmind, which is a mental health platform that only runs till the end of the Headspace should say 2022. Unmind is 2021, and then there's different ones here. We've got a digital weight management programme for staff. So if you're feeling like you've put on a few pounds over lockdown, which let's be honest, most of us did, there's some support for weight management here. So you can click onto there and get that. We will be launching in January a physical health offer. I'm not sure what that'll look like yet because we're just going through the procurement. As soon as that launches, I'll launch it to people like Bina, who will then make sure it's on your websites for you to engage with. But it's not just going to be about physical health. It's all about nutrition and staying healthy as well. So I think that'll be really worthwhile to have a look at. And January, let's be honest, we're all looking for a little boost in January, aren't we? So again, a brilliant time to start putting ourselves first. We've seen increases in substance misuse and gambling. And this might not be you, it might be a member of your family. So if you need any support with those, there's a support line available there for you. And there's different guides and stuff on the website for you to understand what's available to you. Financial health and wellbeing support. Obviously, you know, we're very lucky because we're in safe and secure jobs, but our partners might not be. And you might be in a family that's had a redundancy or something like that, or furlough. There's support available there, and it's about money and pensions, and there's tools and all sorts of stuff if you are struggling. And more important than ever as we're running up to Christmas, because let's be honest, most of us overspend, don't we, at Christmas. The support for parents, different practical support, webinars, different things there. What's really important is the staff mental health hub. This is available to everybody within the LLR community, health and social care community. If you are struggling and you need support, you can, I know that LLR's got a brilliant website, so you can go on the website, and I'm sure Bean will circulate those. This is available for you, whether you're social care, primary care, whatever. You can refer yourself, or you could refer a colleague if you're a manager and you think somebody needs some help. Or you could, even if it was just a colleague and you're having a conversation with them, you could remind them that this is available to them. We're also suggesting that, somebody wants to be referred but is worried about it, perhaps you could help them and make the call or go to the website and click the right boxes. So the Health and Wellbeing Hub in LLR is brilliant and has been working. It's one of the first hubs to have been set up, so is really working well. So please engage with it if you need any support. There's talking therapies, there's all sorts of things. So there's different how-to guides as well on the website. So people might be suffering from lack of sleep, people might think their resilience is low, bereavement, 10-minute pause space. That's a bit about the compassion circle. So if you've got a spare 5-10 minutes, you can access it on your phone, just see what's available to you. And it might be that you just do the sleep guide and it might really make a difference, but they're just like 10 minute snaps, so they won't take up ages of your time. Project M is our support for leaders. And we talked about, I know Bina mentioned and the video mentioned about how compassionate leadership and that's the kindness running through the organisation, isn't it? So there's lots of online resources there on Project M. There's coaching and mentoring support for more senior staff, for managers at all levels. This also links in with the work that the Leadership Academy do. So there's a lot of work that links in with the Leadership Academy. And then there's an executive suite for senior leaders. So if any of them need access to mentoring, psychological support, anything like that, that's available there as well. So we're just about to launch a new health and wellbeing framework. We've got some civility and respect and restorative training going on, and we've got the new physical health offer that'll be coming on soon. I was just about to say what. Also for medics, if you've got medics that need support, we've got the practitioner health line, and that is for medics and senior staff, so they can self-refer into that. That's had some really good feedback as well. If you just Google practitioner health, you'll find that. So the last bit really is about taking a break, and like I say, there's all sorts of offers there for you. So if you want to do some mindfulness, or you want to think about how you sleep, or you want to find out about a healthy diet, there's lots and lots of things that you can do. But the most important thing is to prioritise yourself and your self-care. And I just put this on. It doesn't, like I say, it doesn't have to be sitting in the middle of the field meditating. You can call a friend. You can take the dog for a walk. You can just sit with the cat on your lap. You can. A lot of us have started journaling and find that really useful. You can just buy a lined book and just get started. Take a nap. Sometimes we just all need a nap, don't we? And just having a little bit of a break. Read or watch something funny. You know, Friends is on all the time, isn't it? On the reruns, half an hour of that, and you feel better, don't you? But whatever it is that works for you, please take the time. I now put something to do with self-care on my to-do list, so I prioritise it, because otherwise I'll work my way through my to-do list. It'll get to 5:30 and I think, right, that's it, no time. Now I'm starting, you know, my unpaid labour and being a mum and a partner and all those things. So please prioritise yourselves. I'm just going to stop sharing now. So they're the slides, and I'm going to I'm going to send Bina the slides so they'll be added on the website. Menopause, I'm just going through the chat now just to make sure that I haven't missed a question. Can you coach on the bank? I'm a coach trained level. I think that'll have to be an internal question, I think, about the coaching on bank with bank staff. So I can't answer that for you. Menopause is a massive area for us, and we're really trying to do some great work on menopause. We've got a national work stream just looking at menopause. We've also got one on long COVID as well, because we know that there's a lot of people out there really struggling with long COVID, and also managers struggling to support people with long COVID, because there's so many unknowns, isn't there? You know, we don't know what the long-term effects are going to be. So everything that we do nationally, as soon as it's launched, all the information goes to Bina, and then we work out how best each system then sends the information out in different ways. But as soon as it's launched, then it will be launched within your organisation. But menopause will be a massive focus for us next year. We're also doing some work, as I mentioned, the physical health, and the additional mental health support that we'll be doing, because we will maintain the hubs, because that support is vital. I'm just going to put the right, okay, I'll leave that one. Support for people who feel coerced and bullied into mandatory vaccinations. That's a really difficult one, isn't it? And I would imagine there's people here working for social care with their head in their hands. I'm not going to comment about the rights and wrongs of mandatory vaccination, because it's not my thing. But even if you just want to talk to someone about it and get some advice, you know, the helplines are there for you. Ring those helplines and just talk it through with somebody. What I would say is make sure you're getting the most up-to-date advice about the vaccinations, because we've done a lot of seminars, webinars with people of different protected characteristics. We've had Muslim leaders on, we've had all sorts of faith leaders on, trying to do some myth busting to make sure people have got the right information to work out whether they want the vaccine. But the helplines can deal with any kind of, you know, they're there for it. There's no script for what you ring those helplines for. If you think the helpline will help, just get it off your chest, have a reasonable conversation, agree some next steps. Please engage with those helplines, because they're there to support you.
I think, Sarah, just to add, some organisations also have like anti-bullying services. So, for example, I know at University Hospitals of Leicester, they have a bullying helpline, and they also have a Freedom Speak Up God. So there's, you know, do get in touch with the helpline, but there's other routes possibly from across your organisations. It might be other helplines within your organisation or Freedom Speak Up type services. So there may be others that you can contact.
Yeah, definitely. Are there any questions or any comments? Oh dear, Freedom to Speak won't deal with this issue, already tried. Perhaps then the bullying services, like Bina mentioned.
Yeah. I'm sorry you're feeling bullied, but we understand this. It's very complex, isn't it? The circumstances around the vaccinations are extremely complex.
And I think they're not within anybody's hands, are they? In organisations, it's not like organisations are saying, "Oh, let's do this." I think the problem we've got with the vaccinations is the government legislation leaves organisations with very little wriggle room. Does it? You know, it's very black and white, but it's awful that people feel that they're bullied into it. It's not nice at all. Any other questions or queries, or something that you think that we should be doing that we're not doing, or anything that would help? No. So I shall send that presentation and that'll go on the website. The link to the website to engage with all of these offers is running through the presentation. Please, just like I say, if you've got 10 minutes, just log on and just see what there is. There's something for everybody. There's all sorts of different levels of support. And then if it is that you need to speak to somebody, there's obviously the helpline or the hubs. Remember, you can self-refer into the hubs. So if you want to have a conversation with the hub and see if there's something they can do to help you, reach out and engage, because that's what they're there for. And if they can't help, they might be able to signpost you to somebody that can help.
Fantastic. Thank you very much for that, Sarah. And just to reinforce Sarah's point, you may have some time now. I must admit, the website, the People website, I've actually got as an app on my phone. And it's really handy because you can actually then see all of the resources and access the resources. I must admit, I've been on and used a number of their resources. So I would encourage you just to check out what's there and use what you think is appropriate. So I think that's really fantastic. Thank you very much, Sarah, for sharing that with us. Just on the kindness theme, we said we wanted to keep the kindness vibes going for this week. There is an opportunity for you to commit to kindness and pledge, and we will put some details in the chat in terms of how you can access the kindness pledge. This is about what you can do personally, or from a work context, or even from a system context in terms of the work that we do as a collective. So please do think about your pledge. I have seen Rebecca's pledge, so thank you very much, Rebecca, for sharing that with us on Twitter. Also, whilst we're actually focused around kindness, it's the importance of thanking and acknowledging those people around us, whether that's at home or if it's at work or in any setting. So on our website, we have got some thank you cards, and there's a selection there. So choose the one that you most resonates with you, and you can use that to thank people either at work or at home. But let's do that this week and really keep those kindness vibes going. And my final point, this is our Health and Wellbeing Festival Week. We want to run our festival week again next year. It's likely to be in the summer, and we want to try and come together face to face as well as some virtual activity. But in planning that, we need your feedback. So we need your feedback on all of our sessions. And I can assure you, your feedback will help shape next year's programme. And we make sure we capture and we support you with what's going to be most beneficial to you. So please spend a few minutes completing the evaluation form, which Mariam has put in the chat. And when you submit that, just to say, you'll be entered into a free prize draw, and there's lots of exciting prizes. So do take the time to fill out the evaluation form. Our next session during our festival week is at 2:00. So do try and come back. And so at 2:00, we're going to be focused on embedding a QI culture with Amar Shah, and he's actually from East London NHS Foundation Trust. Really interesting session. So if you can, do come and join us at 2:00. You've got the programme for the rest of this week, hopefully. So come back when you can, and stay kind. Thank you, everybody, for joining us.